When I was a little boy, I loved to take things apart. I'd taken our blender, our toaster, and my bicycle apart so many times I can't even remember. I did this so much that my family really thought that I would be a mechanic. So much so that for my high school graduation, I received a mechanic's tool set for my graduation present. But both of my parents being in the healthcare profession really led me down that pathway. I thought I'd be a surgeon, but as it turns out, I really didn't like the sight of blood all that much. And so I had to take a step back and think about what I wanted to do with my professional career. I was then introduced into genetics, and boy, was I just amazed. I learned things like autosomal recessive, autosomal dominant inheritance, and how these things actually make people sick, and then how we can use these tools to make people better. It really intrigued me. Getting into the laboratory, I was exposed to all kinds of new tools. It was my mechanic's tool chest all over again, but now with different tools. And learning how to use those tools to manipulate genomes really excited me further. This is real patients, real DNA, doing diagnostics to help these individuals live better lives. If any of this information interests you at all, take a look at the skills that you like to do right now. Maybe you like to take your bike apart. Maybe you're handy with tools. Maybe you really like math. You can pull all of these things together in ways you never imagined. And maybe there's a career out there in science, in genetics, in healthcare that you haven't really thought of before.